any supermarket na de obebo na so echirasem na edroso endro me bisa question say anyanya bia eye Ghana Registered Nurses and Midwives Association omu General Secretary Dr. Tenkran anyanya bia no ono health minister ewo issue bia na mehye nkomo a na kabem clearly ono health minister ewo issue ewo nano asem bia esiye ekodu headquarters na nsam wo ho ebusama to mebo na mesane nsemu. Kindly subscribe to Trends GH on YouTube, Facebook, and TikTok. Natural wadwema your comment section ho. Now, yemmonra mochimonka highway news because and there heat no there. Assemble be. Activist Raf on a Rich Hospital, Buhaha, Air Kosono. Any health minister, Honorable Kobna Minta Akando, on also an encounter with a activist Raf after Rich Hospital incident. No. And on a Ghana Registered Nurses and Midwives Association, Omu General Secretary. Dr. Tenkran ebusan obakaya obebo so parliament eni gumbi ebusan issue ho na issue a ewo ho ne say wobakaya this say mu na Ghana Registered Nurses and Midwives Association omo ye say omo ne abandada no eko negotiation bi eba no omo working condition ho SSM eno na nam so a aban foforo we ba ye na omo nam so e de call strike no. Now, we make a call strike, no. A health minister, Honorable Kobna Minta Akando. Oh, yes, say, brought back to negotiation table, no. None of the, cost and negotiate. And then we saw back a Ghana Registered Nurses and Midwives Association. Call strike. Now, call strike, no. In Penifua, did that organization in Minaro. Not they were out of Ghana. So, a health minister, Honorable Kobna Minta Akando. Also, yes, say, Sadia, retired nurses and midwives, no. Australia say, who volunteer on more services. So, assembly free no. In fact, before our Oba granting interview, Asampa FM, Star FM presenter Nankase Bisaro, or Nankasa Kasamano.
You declare a strike action and a minister can decide that you go for a retired nurses and midwives to come and work and try to instigate groups that are within your fraternity that are not aligned with you to step in and all that. It tells you clearly that this is not somebody who is prepared to work with you.
So it's a lot of pent-up emotions, right? Because it looks like you're carrying. It's like you're carrying. It's like you're carrying. It's like you're carrying some. You know.
Our action is not premised on any emotive. I mean, if somebody goes to beat up a nest, what is emotion about it?
So the question I was asking.
That emotion caused against me this morning.
So Osen committee, Raf, Ebano Rich Hospital, who buha heya. And no nam so ebusia where sa obe yusuma health minister Honorable Kobna Minta Akando no me pese me repeat wa. So that's no supermarket no akwache ye pa. Eno Oheneba Boama Bene ono de ochem se. Our message Emma Dr. Tenkran General Secretary for Ghana Registered Nurses and Midwives Association.
So condition nyina e wodem ha no. The heat abakofi. So condition nyina so bibia wo fan kraso. Papa Crawford, there is this guy called Tenkran. What can some phone pa batie? Tenkran, so person we a politician. Brahma yensia. And some phone you know. I told you the last time, say yeah, the get and mudada. Yeah, no, some phone galore, yeah, go hano. Ya can some phone a prison yabano. Will be enemy the whole world international will be enemy yang. What can some phone become yatro? One rabu problem in Takando, your honorable. But the prima fan enemy from Essence Microman. I will never ever allow you say for an enemy from. How dare you? Who the hell do you think you are? What am crying? My young will be a mananke casab in some the minister. Say ordinary thing crying. Ordinary thing crying. Thing crying ya win the house number. What can't the minister say? What can say Kuyani? Tenkran what do you adwuma? I was so kokohu Dr. Yenuso Maluk no bio witino so no hwe say wo madula oblongata no everything ye intact na say bibia totima wadwunim what you need to say ye bio witino so your person wo ho me hu say wadwunim nyina ye intact because say ye usi kasa no anya me woma say ya de aduru so ya ye ka ho asem no bipolar wonya bi minister kasa Usu kasa se kuyani na kuyani kasa sen yete krom hayi ye kuyafo kasa e de your doctor for kasa apart from ntwira funu a we di to krom ano e de kasa na munim kasa. How dare you? Ghana Registered Nurses and Midwives Association, aka GRNMA. Mokwa for MPP ni Mami Perpetua and the way get to Samefi. MPP ya sanema because Nikunu a MPP chairman ewe English yamanfu. And what to one MPP agenda. And what we say, Yahuneti, etitem kurai, and an adjument argument, you push it from crown kwa yajuma. Kuyani kasaseng. Me mami yakuyani, me papa yakuyani, me nana yakuyani. Babushi yafon na yakuyafon kwa. Owura John Dramani Mahama, the president of the Republic of Ghana yakuyani. Owura John Selassie Katia yakuyani. Majuma wura wa yakuyani. Etukuyani kasaseng. Wajuni nye. Ana we yare. So kasase kuyani. Na some impredia so no more problem in takando utipeno no. So we are nini abema nkojari wi ankane na since you come from yare. Tenkran. Ana wanya kwanya kwa kobo PhD. Ya for Dr. Tenkran. Etu wadu ne se wahwe book. Adwen ko na nyansa ko Tenkran. Fanim dia ne nyansa to kasa ho. Tenkran. Fanim dia ne nyansa kasa. What to make a minister say na some no can you senseless. Who made this useless guy? The General Secretary. NPP Jareo. I am warning you for the last time, Tenkran. You are just a General Secretary for the group. And I wouldn't him. Now, when you come and declare strike, I will come. Tenkran, listen to me. Tieniye. Manyansa way and coutrim. And I wouldn't him. Now, when you come and declare strike, I'm in the problem. I swear God to say, Tenkran, baby, I will be ano. You better show one why you fool. When you also with your bema, try. Now you will reach you. Tenkran, be very careful. I've warned you. Now the also go do that.
So incident at AC or Ridge Hospital no, and on a Kevin Ekobedu Taylor which him say before I Oba address the health minister on a General Secretary for Ghana Registered Nurses and Midwives Association, Dr. Tenkran, that Bruha ha air cost no Oba address your mono. Ebusia, way a introduction on RAF versus Ridge Hospital. And some are air course no.
As some I see a Ridge Hospital, I say Ghana brand to be friend Ralph, and then a friend to be called Ridge Hospital. Na omope treatment. Treatment na omope every hospital personnel no hono. The way na omope the attention from the personnel munsankenti. Whatever happened there, we on Loud Silence TV, Loud Silence Media, we condemn it 100,000 times. It is condemnable. Nobody should sit on any platform to encourage it. Whether there were casualties or whether there were not casualties. It is not acceptable for anybody to walk into any health facility to pressurize personnel in any form. So I condemn it outrightly. And this platform, we don't mince words when it comes to we making our point clear. Now, the reason why I issue a gaining momentum, Kakranana say, there are people who deliberately want to politicize this particular issue. The reason why I'm saying say politicize, and then I say, in any settings or organization, institution you enter, there is something called a management. And that management, it is their responsibility to make sure the day-to-day running of that institution, whether financial, whether maintenance, whether security, it is the sole responsibility of that institution's management to make sure those things are effectively run. People who, at the end of the day, have decided to hide behind associations to run this country down. And let us not get this wrong. The Ghana Registered Nurses and Midwifery Association, it is like any other association in Ghana. It is a Ghana Tomatoes Union Association. It is a Molikoko Sellers Association. It is a Mampam Association. It is a Ghana Bar Association. An association. Remember, the president of the Ghana Registered Nurses Association, Midwives Association, Sama Ameno, Nikunu MPP chairman. This guy is her deputy. This guy is her general secretary. Now, this guy started a campaign, and that campaign was straightforward, geared towards the minister. And you ask yourself, why? Now, minister, no, na minister, na ya, and the Asomisi Hospital, the management of the hospital has been left out. The board has been left out. But straightforward, the minister is the one being questioned.
So, Dr. Tenkran, Superman, ni Gumbe. Odema Health Minister, Honorable Kobne Minta Akandono, Assembly Kodu Kevin Ekobedu Taylor and headquarters I watch him say, on this message when I was sending to Dr. Tenkran. Hey, information there we are saying. Cars for the association. Sasang.
He's just a mere association secretary. Or the toilet man or Cambodia. Now him there, yeah. Osako Asempa in the second interview, no. The problem you know say, Minister ni nimunyansa. Inti kwasia when samana oke kano. It wasn't because onim de oyo. He was doing pure politics. At a point, otumi bien no crack catch the ministers na wo ye kuani ana. This guy, okasa wa Asempa no. Obien no busa minister na wo minister wo health minister wo ye kuani ana. Sa ankwasiafo we bi na yaso so mo so Ghana. Akando is a farmer, and there's nothing wrong being a farmer. We need more farmers in Ghana. The president of the Republic of Ghana is one of the biggest farmers in Ghana. Most of the rich people who are intelligent in Africa are into farming. But this guy who says he's a doctor, debi ameka se we mu no mo jimi. Debi ameka che Ghana for say san kwasiafo we no omo jimi. This guy is going in, he's doing politics. You know why? Mamika bibi nchiramo. This guy is using the nurses for his own political vendetta. They don't like Akando. In the previous administration, how many times did you see the Minister of Health enter a hospital without any announcement? How many times did you see that? Not in C. For 8 years, for the past 8 years, what these people enjoyed as the leadership of GRNMS, whatever, no, they were being broadcast by the ministry, politicians. Including BB, they have this cartel, and it is led by this guy and the president of the Ghana Registered Nurses and Midwifery Association. This is what they do. A buying buyer every year be a momuka. Now, since Akando took over, Akando made sure say he wasn't going to use his office to be buying cars for people who lead associations. And that was from day one. Some of them came together to say, we are going to embarrass this government and whoever is the minister. And then they started striking. And the Aqua Wagina ready to edit them. Say, na minister no Ukrainian, hey, Ukrainian no ye GRNMA unya bidino. Kwasiawa when this application bottle I say, Eka and say, minister ni Ukrainian. Yes, why Ukrainian? He is growing food for a fool like you to eat. The fights they have with Akamba are two things. Akando. One, it is because Akando has been going to hospitals without announcing and exposing the things they are covering up. And two, Akando is not buying any car for them, like the way Ajimamenu them used to do for them. That is their problem. And the agenda is there. How can a fool like this speak to a minister of state, a minister who is in charge of health? You call yourself a doctor and you sit on TV, on radio, and you speak to a minister this way. Who is your employer? Mr. Nancy, I'm a president to do Kwano. Akwa Webesha, now or the office visa fraud. This guy. That is why they don't want the position to go. You people should start talking and thinking. And yes, sir, omube yuzumwa che. Because Oshe Asamo Yawesia a purely managerial issue. A purely managerial. The minister came in out of courtesy. Nobody can blame the minister for what happened at Ridge Hospital because the minister the Tiakra, Asam si Obuasi Regional Hospital and now Obuasi District Hospital. Do you expect the minister to come all the way to Obuasi to issue an arrest? Are you stupid? The minister took steps. All because of proximity. Maybe an office war, and maybe a Ridge Hospital war. That is why the minister, out of courtesy and also feel the sense of responsibility, walked there. It is not the responsibility of the minister to issue an arrest or arrest anybody who comes to the hospital to cause chaos. It is you calling yourself a doctor. You sit back and you ask yourself, why should I even blame the minister? And that go to the point to blame the minister's police officer who is guarding him. Is it the responsibility of the police, Minister of Security, to arrest somebody at the police at the hospital? But you see, I'm about to the level whereby they are even insulting farmers. When you be to minister, now minister, or Ukrainian, is he a farmer? Yes, he's a farmer, and he's a well-to-do farmer, and he has made a lot of wealth from being a farmer. The same way, reasonable, intelligent people who really want to make decent wealth go into farming, not like fools like you. Hiding behind titles, association. So the reason why they have this fight with the minister is all because the minister is not doing what Ajimamedu Dems were doing for them. They were expecting, say, a business society, Akando will come and buy V8 for them. And that the moment they do that, what happens is they say they don't talk your matter. And it's for 8 years. You never saw these pigs speak against any minister Nana Addo Dankwa Akufo-Addo made the Minister of Health, because that is how they saw it. Those ministers were every day, every time sorting them out. Into right now, no, if Akando is here paying this unannounced visit to the hospitals and trying to find answers or solutions to things that they are hiding, no, and now Akando also not giving them that cards, they have ganged up to disgrace and destroy the government. How can you sit on TV and blame a minister into some way you see, you know, ekosi wo kwabre anka bega minister say on for planning ko na onko solve issue na we kwasia. Now let me talk to the reasonable nurses. Mameka be binchiramo sanko for we, they are using you people for money. I'm telling you. Now as a nurse busa se bibi kra how ewo income prom baby a we adwuma no na so person association we a utia dues ma no. Debia, you tell salary mawa, they take some from your salary as an association. Ask yourself as a nurse, since you joined this association, baby, your working condition. So, pass on a message. What are the kind of process I will film and sana kwasia we ati? Ask yourself. The nurses in Ghana na Moshesa association we aseno. Your fundamental problems now, you expect your leadership to even give you a listening here. When you try to call them directly, what do they tell you? They tell you, say, talk to your district director, district head and secretary, talk to your district operations manager, talk to your district head and chairman, before the district chairman can take your complaints and take to the regional before it gets to the national. It's just an association. But they have created those barriers to make themselves feel important. He is doing politics with the nurses. They are using them to make millions. Into the moment any politician comes in as a minister and blocks that path that makes them make money, they start to gang up against the politician. And that is what you are seeing here.
Now, Ridge Hospital incident, no, Obakaya, CCTV footage be up Monchimonka Highway, no, so I know the best 1 minute. Now, another Bushia, Obasha, Raf, approaching one nest, but Emi Chema, Omodi Omuhu Assortibia, Emisu Chema, Omodi Omuhu said, Raf. Opushi nurse baako ewo ho mo na esensem we na Kevin Ekobedi Taylor o chem say in fact ne ekọ so ho na nya 1 minute na 7 hours CCTV footage na ono Kevin Ekobedi Taylor wabo footage na eliki ye no ene afiso no ono wankasa CCTV footage a ewo na kache no so wa drop na eno na amanfo ka ho nsem ewo Monchimonka highway no so.
Now let me show you something. I have a 7-hour footage of what happened at Eyedien, Ridge. After this show, we released the 7-hour footage, a CCTV. Ralph Mokoho, they see it after. It is in a 7-hour footage. Nobody has this. Menkwana is a 7-hour footage. You know the reason why they put that short video out for people? It was for propaganda sake. And intina, sa video you could not see a physical assault on any nurse, but they wanted the narrative to look like that. And intina video we are. This is the only video they put out there because they wanted to create the impression, say, but this video is a small part of a video of a 7-hour video. Hwe video ni ye pa. Nurse na omo interview no. Ono na na ejina lady na o she red ni chi no. Nurse na o se ya bono no. Nurse we ono na sha tade we hwe ni ye. Nurse we a o ka say. So o she rough video na me chiro na ono na ejina sa ma me na o she red ni chi. This nurse.
When he came in.
Into ono krampo no. The altercation no krampo no. And shut down kon ho. Now, Mamimbo, the original CCTV, it's about 7 hours. I'm going to play a bit of it. Time Ralph Eremu. Ralph Tenase. Ralph was asking them, Ralph APA. Do you know, say, time Ralph more hospital or not police in you? There was a police officer in there. Why didn't that police officer arrest Ralph more if they were actually causing the chaos they said Ralph them were causing? Do you know, say, Sata mana Ralph Mohona, call hospital inside. Mu first. Ralph Tenase or say or they goes or said two in same again. Do you know, say in that 7-hour video, no, there was a police officer in the police station, in the hospital. There was a police officer on at post. So I want to ask, say, I didn't say police officer no answer Ralph mo. Say na Ralph ma de omo ye ho no no. Say na Ralph mo commit crime. I am saying I'm not going to justify any act that is unlawful, but I am talking in context of video na ekuta ye no ene de ye hwe no. That's because sir Ghana Registered Nurses Force Secretary no, he is trying to create the impression that there was no security officer at the hospital when Ralph Dems were there. Now, this is the original CCTV. Because of time, it meant to me about 7 hours in a show. But I'm going to scan through. Young boy be de ne nana baye, ne nana. Or the ne nana baye, ne nana no kuta no emergency was in the video. I'll show you. There were nurses there. There were some nurses sitting in rooms, sir. Oma come na to so no more phone so. And there was a young man with ne nana kuta no. And a ojina ho. And nobody was attending. Now watch this. The same time, Ralph complaining about the sense of urgency. A man walking out to say, "Okofana dam funankasa de nabano." The same time, no, obi tamne nana. This is emergency center. When you regular hospital OPD or something. No. This is emergency center. Obi kutane nana, ne nana, almost 80 to 90 years. Sorry. Did you see any medical person there or so a nurse or show any sense of urgency? I'm asking. These were people there. They sat down and directed him. Visitors had still akonwano. Omokate said, go and put that old lady on that chair. This is Rage Hospital. Mo nurse for no. Sa Ghana Registered Nurses and Midwife Association. They are using you people. Kwasiane Kasano, our service or condition, service conditions, condition of service, is it a play here? My member video na men call Ralph for the end so. Me say 7 hours. Now, I couldn't tell me when say me person mo nurse for Kwarana mo Ghana no. Sa mo association no. Sa anko from the enim no. Omo use mu say moa. The omo ye no politics oh. They want something for themselves. It is not you. Sa akwana na okasa odidi minister na tem no. Na ono odidi minister na tem no. Wo nurse na wo form na uhia bibie free aban ho no. Ojensa won sabeka. I just want to show you some part of Ralph eba ya okoye. It's wrong with the Ghana Registered Nurses Association for me. Oh, so shall I be one of the who down into my white takatan? So we Aberwana Owuno. Oh, so not the Honda Kunyano, so I know into my white takatan. Ralph bar back now, Obekachom say, what kind of work are you doing here? People need assistance. And a nurse in Mumu warning, and all retaliate in the same language. That part now is see what a honum could try and on the brebo. It is a guy we This guy went to the hospital and told them to ignore everything that happened and cut that small piece and share it to the public. And they used that to destroy the minister. That is what they did. 7 hours. So what they did was that Akwa Weko Hospital and Okakachiromo say they need the footage, but just our part from media no one can say minister the fault. Now Ralph Akobu Obiekuno, Omuwie no mko dress nurse and Beka Chem say Ralph butu nurse ne kuno. This is the guy who did that job. Footage in other angle na no. But you see from the beginning they didn't show you anything. And there is more. Just 7 hours now soon. This guy is a very dangerous guy. My member last hour in Chirobium. Abroano da konyo da honda so time Ralph Oba or say what are you people doing? What is happening here? The nurse was rather insulting Ralph. And then the man back and say, and nobody has this footage. I am in Quantum what this footage. I'm the only platform I want this footage. Make a seminal HH Matro. Now this is the video again. Wait, and the coach has a video in the buy. Or then the coach that angle now. Sa 1 minute no but Chema Paul at the Mochi or the Ma Sempa or the Ma Joy News or Chema Media Houses no and also go after the minister. Because the target is the minister, is the government, and your politics no more. And it's a money for no more. They are using you people. They don't need to lead anybody. You saw 2 policemen there. I don't agree with what he did, but there were 2 policemen at post. Sir, Akwawe, Jana no all kind of radio no so no. Ose minister ni mum police officer na or protecting mum ne meche Ralph. On politics oye. In the interview no, or catch a girl and say, I then a minister na oba ho the next day no, or no mum, some minister no mum police officer na enche Ralph. But incident ne happen here no. Na police officers too no ho. Into the issue no a management and I say a minister issue. There were 2 policemen, one was armed. And it's a Ralph and Parampara say, oh ra police a hospital and butu next we bu in some modern bet now. Sakwa when the coach video, first video the babe chirebono. And no 1 minute no the ma will be I say this is what happened. Ralph assaulting us in the there is no video of Ralph assaulting that nurse no bet now no. Sa nurse no bois. A way is the handwork of this guy. He went to cut that short video. He put that nurse there to act. This is the guy who did it. I have the 7-hour video. Me publish 7 hours video. Mama shedi na. We are a dangerous guy. And I'm talking to the young nurses in Ghana. Mo joining Sa Ekuwe. The better for you. It is better for you people to leave this organization and tell these fools they are using you.
Into where they are quite a part to part. It was actually why you your comment section. Let's share video we ma afofroso and sankebi. Macro. What per company ba ko ebusia omusipi esita when it comes to assassin some any documentation Landkin Company Limited and American for more amount. Many will say or more in Sasi Bebre no de or more ton ebi ewo oba krowa Asalaja, Pokwase, Afieman, any other places where the baby bia wope asasi bia no for Land King Company Limited na ebusia omobe soto te saso na eba na cadastral site plan, building plan, any office almost also facilitate a title certificate, any of building permit won SNSM padia or trusted source a Land King Company Limited. No more can say partner S and build confidently.